Hey, everybody, welcome back to the Modern Customer Podcast. I'm your host, Blake Morgan. My next guest is Sven Gierlinger. He is the Senior Vice President and Chief Experience Officer for Northwell Health. Northwell Health is New York State's largest healthcare provider and private employer. Northwell has 104,000 employees. Sven drives cultural transformation across Northwell's 28 hospitals while focusing on putting patients first. A previous hotel executive with the Ritz-Carlton Hotel Company, Sven brings a unique perspective to customer service. His medical journey and personal patient experience motivates him to disrupt the status quo in healthcare. From elevating hospital food to Michelin-star status to harnessing technology and AI to analyze patient and caregiver survey responses, Sven keeps the pulse of Northwell's patients and improves their experience every step of the way. Please enjoy Sven Gierlinger. Sven, welcome to the Modern Customer Podcast. I'm so happy to see you today. How's your day going so far?
So far, it's been a fabulous day, so it's a pleasure to be on the podcast with you today, Blake.
Sven, reading your bio, your background, you are the perfect person to be on the show because you started your career in hospitality. You've worked at the Ritz, you've worked in healthcare, and there's so many interesting parallels between hospitality and healthcare. Do you like the trajectory that your career journey took from taking you from hospitality to healthcare?
Absolutely. I would even say something stronger that I love it, and I never imagined that career trajectory. If you asked me when I started in hospitality in the kitchens, actually, when I got my chef certification, that I one day would work for the largest health system in the state of New York, leading customer experience, I would have said you're crazy. So it's been an incredible journey that I'm very grateful for, and you never know what opportunities come your way in your life.
So let's go back to the beginning when you started at Northwell Health, first 90 days in the role of Chief Experience Officer. What were your priorities back then?
So I've been here 11 years, and Northwell was not my first foray into healthcare. I had 6 years with a healthcare organization in Michigan, Henry Ford Health. That's where I started with zero healthcare experience, opening a brand new hospital. And the so I had a little bit of experience in terms of knowing what's important in healthcare. When I joined here, I was very intrigued because Michael Dowling, our former CEO, created this position, and nobody had the position before me. I think it was Richard Branson who said, if somebody offers you an opportunity and nobody had it before, and you don't really know everything about it, just take it and figure it out. So I started, and the Northwell at the time was about twice or three times the size of my previous organization. So I needed to learn very quickly, and my immediate focus was on building the relationships and understanding the system, where we had about 17 hospitals, I believe, at the time. So I basically spent the first 3 months in my car to drive to the various hospitals, medical facilities within our networks. I met with the leadership. I walked the buildings. I sat in waiting rooms, often also without my suit on, just with a polo shirt and a baseball cap, and trying to immerse myself into the current state of what the patient experience was like at the time. And it was eye-opening. But the biggest part about that really was to build the relationship with the people that I'm going to have to influence to drive patient experience across this organization. And I tried to figure out, what are they proud of, actually. I was brought in because patient experience was something that they have never been able to get right. Have had a lot of successes in other areas, in quality, in finance, etc. But every place I found, there was something that they were proud of when it came to experience, and also to figure out what the current challenges were, what was holding them back, and then to figure out where they wanted to go, so that then we were able to come up with a plan together to collaborate to move it into the right direction.
I like it. So moving it into the right direction is what we're talking about today. I think that's what every company is trying to do with customer
Yeah.
experience. But it can feel like sometimes it's two steps forward, one step forward, two steps back with tech, with AI. Talk about technology and the role technology plays in your CX strategy.
So technology is critically important, especially as we're looking at the experience today. But before that, I think a lot of it is built on culture. You can solve patient experience problems with technology alone. It is the integration of the human experience that is seamless with the technology that will make it work and create the magic. And technology plays a huge role in solving some of the issues that I consider as friction for patients they experience. So it's the oftentimes the things outside of the medical encounter itself, and it allows patients to interact with a healthcare provider and the institutions in ways that they are used to in their other daily lives, like what you and I use our phone for banking, for airlines, for shopping, and that's what really unlocks the potential for patients. And in that scenario, then they're really customers of our organizations. I always say they're customers to us as an organization. They're patients when they're in the bed and when they are in the exam room. There's a very sacred relationship between the provider and the patient itself, and the technology can be very helpful with that.
So, in your bio, I read that you're interested in just bringing this more beautiful hospitality experience to healthcare, like even providing Michelin-star food to patients in a hospital. When people think about food in a hospital, they don't think about a Michelin-star. And I can remember when I had my kids and I was in the hospital giving birth afterward, I did Uber Eats or family brought food. Like hospital food is doesn't have a good reputation.
Yeah.
What makes you different or special that you can really think outside the box to create this different experience?
It started with the voice of the customer, and what you just described is exactly why great hospital food is important. You didn't have great food in the first place. There's a burden placed on your family now. Instead of visiting with you and supporting you, they had to run out and get food, right? That's what happens. It's And I didn't understand why the bar has to be so low in healthcare when food is actually something that's easier to tackle than brain surgery or other complicated procedures that we do. But it started with the enormous amount of negative feedback we got about it. And when we did some deep dive research with our patients, specifically when we asked them, what's the difference between good and great? Why did they give us a probably recommend, and what was necessary to get to a definitely recommend in terms of net promoter score? A lot of them talked about the food,
Mhm.
and that's when we went on this journey to fix it. And since I have a background in that and coming from the hospitality industry, I have connections and know how that industry operates. So I hired a chef who has never worked in a hospital before, and he was a chef at the Plaza Hotel for 15 years, and also had a Michelin star at the Sonoma Mission Inn. Worked in three-star Michelin restaurants. His name is Bruno Tisson. He's from France, and was able to convince him to join us. And he then brought other chefs that he's worked with in the past, and we have 5 chefs that worked in Michelin star restaurants. We've have others. Almost everybody has worked in the finest restaurants and hotel chains, and because you have to have great chefs in the kitchen to really care about the food, and that's what was missing before, that nobody cared whether the food tasted good or not. They just slapped something on a plate and sent it up to the room, and what the perception of the patient was didn't really matter. And now we have chefs that actually taste the food, and they worry about every single plate that goes out of that kitchen like they do in restaurants. And we've been able to purchase fresh foods and have the chefs prepare fresh from scratch meals. And
I
now we
love it.
even now we're even changing the way parade foods for ICU patients, which some hospitals it's 20% of the patient population. And if you've ever been in an ICU and you've seen what that food looks like, you can't eat it,
Hmm.
basically. And so you have patients that need nourishments and then they don't get it through the food that we provide. And so it's eliminating waste also, and it's more efficient to do that. And we've been able to get from when we started in the 10th percentile for quality of food on national benchmarks to now the almost 90th percentile. And where we got complaint letters before, now we get love letters about the food.
Wow,
And and
congratulations.
and it's where we realized that it's part of the care. It's not it's not outside of that care. It is part of the core thing we do in a hospital, and it's been so rewarding, and the clinical teams are all acknowledging it, and it's been a wonderful journey, and our patients love it.
That's awesome. Good for you for standing up and just saying, "Well, why does it have to be like this? Why do
Yeah.
patients need to come in? They spend a lot of money in a hospital, but the food doesn't really match the cost of even the experience." So good for you for doing that. Let's switch gears here now and talk about technology again. Let's talk about AI, some trends you're seeing, how you're using AI inside the healthcare system.
Well, AI is obviously the hot topic. I think no minute goes by when you don't hear about AI, and it's certainly very important in healthcare. We have a lot of AI initiatives underway, and there is either the AI that directly impacts patients or the ones that help the providers in their workflow. And those are the ones that really get a lot of traction, I would say. I'm sure you've heard about ambient listening. That's one of the big ones that we just signed a contract with a company called Abridge to roll it out across the whole health system. So every provider is able to use it. And what it does, and what research shows, is that physicians actually spend only 27%, an ambulatory physician, with patients in their direct care, and 50% with with the EHR or administrative responsibilities.
Yeah.
And now that reduces that 50%, and they can actually spend more time with the patient, not looking at a screen or being tethered to a keyboard, but to look the patient in the eye, to have a direct conversation with them, to talk about what's important to them, how do they collaborate on a better care path. And it's also increasing their engagement because now they don't have to do pajama time after they get home and have to document for 2 hours, which, talk to any physicians. That's what they most of the time do. Have dinner with their family and then go back to the computer. And that's what can be reduced. So ambient listening is just a great invention and gets a lot of traction of providers that where we've rolled it out. I haven't talked to a single one who doesn't love it.
Yeah. So, one of the things that you hear a lot now with patients with healthcare, even your own family members, they are using ChatGPT to look up their own symptoms. I've even heard examples of patients basically healing themselves by using some kind of AI to get to the heart of what they're experiencing and finding like very specific and niche doctors or solutions. So clearly, like this is a new world, and healthcare. We thought healthcare would be disrupted a long time ago by IBM Watson. Do you remember
Yeah,
the
yeah, of
healthcare innovation? But it
course.
never really took. But now with OpenAI, I mean, it's just like this incredible time. Is it shifting how you think about patient experience with now patients sometimes even using the AI, or are your staff using AI? Are they allowed to find out what's wrong with a patient?
Well, I can give you one example. AI in terms of chart summaries. Think about a patient's chart and how much information that is in there, especially with complex cases. So AI does smart chart summaries where it fishes out the information and presents it to the doctor to show them what's important for this particular visit without now spending 5 or 10 minutes to actually go through the chart. But the concept around patients using AI for their care is something that we should be embracing, but to instead of letting them go to ChatGPT to figure out what AI can a healthcare organization create that they can use and embed it into the workflow so that it's more of a trusted
Yes.
tool. We, for example, we created an AI hub for uh, all of our staff, particularly for providers, but administrative staff. Anybody can use it because if we would go to ChatGPT, then you put that information out into the universe, and there's potential PHI implications, etc. So we built our own AI system inside our firewall, which I use every single day. Our providers use, and it just makes life a lot easier. And there's also, think of messages that come into physicians, right? There's often they don't have to even see that message. Somebody else can answer that question. So let's say there's 100 messages come in, and they may only need to get to 20 or 30 of them, and others can be rerouted if it's about medication refills or other basic questions that patients have, that can sort that and triage that and make sure that the right person gets to that.
Yeah, thank you for not getting, frustrated with that question, because that's a tough question I just gave you.
No,
Because
I mean, I appreciate it, and it's any question like that makes you think about it, and if I'm experimenting with that. I just had test results myself that I had from a doctor's visit, and it got to me before the doctor saw it because it came in the middle of the night, and I put it into AI to see, please explain that to me. What does that mean? And I got a pretty good result. And then I compared it to what the physician said. It was slightly different. It worried me a little bit more than when I got the response from the doctor. That's why I'm saying one should be careful with that, but it's definitely a great tool.
yeah, it'll be exciting to see how healthcare changes, evolves, transforms in the next few years with AI.
Oh yeah.
It's just an exciting time. Let's talk about measurement. In a healthcare situation, in a healthcare scenario, all kinds of metrics can be used to measure patient satisfaction, employee satisfaction. Is there anything unique or different about how you approach measurement at the healthcare system?
Yeah, and that's a great question because that's something that we've embraced, and to think of measuring differently. What stands out to me is that how we measure experience in healthcare, especially for a large integrated system like ours, we measure in silos. We ask question, how was your ED experience? How was your physician experience? How was that hospital stay? And it's not really connected. So we're not measuring with a patient in mind. It's always episodic driven. I'm sure you've gotten those surveys, right? So
I got one after I gave birth in the mail. It was like a 6-page, I couldn't believe it, snail
yeah,
mail.
yeah,
I
we
never
we
filled it
we're,
out.
we're past that now.
It was
We're
a long
actually
time
sending them
ago.
with text and email, but we'll get to that in a minute. But it's what we found is that a lot of the what I call friction and a lot of the effort that patients have to put into happens outside of the medical encounter. And again, it's not connected. So we are surveying across all of those interactions that somebody had with us over time, and asking them based on that, not based on an individual encounter, how loyal are they to us, and how likely would they recommend us. But more importantly, we're asking how easy we made it for them. And that is a question that is critically important and typically not asked. So it's a CES, it's a customer effort score that, as you know, many companies outside of healthcare use. I believe that we're one of the first healthcare organizations that has worked with Press Ganey, the survey company, to develop that. And now we have data on that. And now we can actually, over time, see whether we're improving, whether we are making it easier for our patients and removing some of that with effort that feels heavy to them, and it feels like they have to have a part-time job, or it is like a part-time job to do all these things to manage their health. So that's something that we've implemented. And then also, I think eventually, and I hope we will get past the survey stage. There will be regulatory surveys probably that will still be mandated to do, but the concept around always listening and using technology to do that when somebody calls into our call center, makes appointments, what is, trying to figure out what the sentiment is, to the interactions itself. How can we use AI and ambient listening technologies to do that? You can learn a lot about the sentiment of a person without having to, you know, just tether them down with surveys.
So, one of the things that many of us experience in healthcare that's very difficult is just culture. I was in the
Mhm.
Philippines a few years ago, and there was a nursing manager there in the audience. And he said, Blake, I have nurses working 12-hour shifts and they get tired and the mood can go down. And so, how do I keep them fresh and happy? So, could you talk about what you do to create an employee experience in the healthcare system to keep everyone fresh, focused, and delivering the best patient experience possible?
Yeah, that's a key component of great experience. You can't have employees that are working at their best if they are burned out, if they are experiencing challenges. So the partnership and the collaboration with our partners on the HR side is key. So we really see that as integrated. But it starts always with reminding healthcare workers about the why they do what they do. And when we started our culture work, we heavily dove into that, and especially starting with leadership. So you have to start. We started with our executives and the broader leadership before we even trained our employees about why are you in healthcare and what keeps you in healthcare, and that almost re joining that motivation they had when they first went into it before they got burned out, and that's something that you have to constantly remind people about, and we do that through storytelling. I can tell you how much emphasis we place on that. We film patients that had an experience. We filmed them with the person that was either the doctor or the nurse or whoever it was that made a difference for them. The letters we receive, the feedback we get, to just plaster the organization with that, because that's what somebody needs. Often, one of my daughters is actually a nurse. She works in a health system. She's in one of our ERs, and she said the other day to me that the her manager told her in the middle of her shift about a patient who left a positive review about her in one of the surveys, and it re-energized her for that day, because it was a pretty rough day, and it was a horrible day in a Manhattan ER, and that's, you have to overcome that with positivity, and as I said, you just can't stop it. It's a constant effort to do that, because there's a lot of negativity, and the things that patients or employees deal with at the front lines, that they're tough, especially in this era now, past COVID. I think our society has changed. People are more aggressive. They have less tolerance. They have less patience, and it's not easy to be in healthcare.
Why do you think that is? That's such an interesting statement. Why do you think people are more agitated, less patient, like in a hospital situation? Are they more worried they're going to get sick, or what? Why?
Well, there's more at stake, right? So there's when your health is at risk, and when one of your loved ones is in the ER, and or in a critical situations, that makes that I think people act out differently in those situations. But also, you have to draw the line, and where that line is, and protect the employees when they're out of control. And it's a balance that you have to strike there. But yeah, in healthcare, it's challenging.
Yeah, my dad worked at Kaiser for over 30 years. And he worked in the
Oh
ER
wow,
as an ER psychiatrist. So I've heard a lot of the stories. And
I bet you have.
yeah, it's a tough industry, but
Yeah,
rewarding because you're healing people. I mean, what is better than that?
exactly.
Let's do this rapid fire that I explained to you before the show. I hope you still want to do rapid fire, which are quick answers to quick questions. Does that sound good, Sven?
I'm up for it. Let's do it.
All right. What's the most important part of your morning routine?
Um, I love to run, so about 3, 4, 5 days a week, I try to run. And when I don't do that, then I don't feel the same. So it's typically about at least half an hour to an hour.
That's awesome. What show are you currently streaming?
The Big C.
Okay, I don't know that one. I'll check it out.
It's about a person, a woman who has cancer, who is my daughter actually told me about it, and it doesn't sound like it would be funny, but it's actually really funny because of how she views life and how she acts as a result of that.
I'm sure that also informs your work because you are healing
Yes,
people with cancer.
exactly.
What's your idea of perfect happiness?
Well, running is one of them. I love to spend time with my family, entertaining, cooking. That's when I'm in my happy place.
What's your favorite type of vacation?
Traveling to cities. I'm not a beach person. I'd rather explore a city and learn everything that I can learn about that and immerse myself in the culture.
If you could have lunch with anyone dead or alive, who would it be?
It's so many people. Barack Obama.
Okay. And lastly, if you had to describe your outlook in one quick motto, what would it be?
I'm an optimist, so I'm very positive about the outlook, and especially the experience work is never done work, and because expectations change on a daily basis, and you always have to stay ahead of it and making sure that you deliver the best possible experience you can.
Love it. This has been so fun. Thank you for taking the time to do the
Likewise.
show, Sven.
Thank you for having me. It's been a pleasure.
Everybody, you've been tuning into the Modern Customer Podcast. Thanks for watching and listening. Until next time. Please don't forget to like or subscribe and follow my social content on other platforms where I post content daily, including X, Instagram, LinkedIn, TikTok, and more.